Drugs used to treat the diseases of blood. The mostly common blood disease is anemia. Anemia is a condition in which people lack enough healthy red blood cells to carry adequate oxygen to the body's tissues. Having anemia can make people feel tired and weak. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term, and it can range from mild to severe. Red blood cells, RBCs, or erythrocytes are the most abundant cells of blood. Their main function is to deliver oxygen to all tissues in the body. 1% of circulating RBCs are reticulocytes, which develop in the bone marrow and mature to RBCs after 1 day in blood circulation. It is important to note that RBCs do not have a nucleus. Hemoglobin in RBCs. Hemoglobin transports oxygen from lungs to the cells in the body. The hemoglobin molecule contains iron, an essential mineral found in our diet. Hemoglobin is an iron-rich protein in red blood cells. Oxygen entering the lungs attaches to the hemoglobin in the blood, which carries it to the tissues in the body. Folate is a water-soluble B vitamin that occurs naturally in foods. Folic acid is the synthetic form of folate that is found in supplements and added to fortified foods, such as white flour, white bread, and a variety of pastas and nutrition bars. Folate has many functions in the body, helps tissues grow and cells work. Works with vitamin B12 and vitamin C to help the body break down, use, and create new proteins. Helps form red blood cells, helps prevent anemia. Iron is an important component of hemoglobin, the substance in red blood cells that carries oxygen from lungs to transport it throughout body. Hemoglobin represents about 2/3 of the body's iron. If body don't have enough iron, it can't make enough healthy oxygen-carrying red blood cells. Causes of anemia. Different types of anemia have different causes. Iron deficiency and folate or vitamin B12 deficiency are the common type of anemia. Iron deficiency anemia. This most common type of anemia is caused by a shortage of iron in the body. The bone marrow needs iron to make hemoglobin. Without adequate iron, body can't produce enough hemoglobin for red blood cells. Without iron supplementation, this type of anemia occurs in many pregnant women. It is also caused by blood loss, such as from heavy menstrual bleeding, an ulcer, cancer, and regular use of some over-the-counter pain relievers, especially aspirin, which can cause inflammation of the stomach lining resulting in blood loss. Treat iron deficiency anemia. Could oral take iron, intramuscular injection, or intravenous injection iron, but intravenous injection may result in very severe allergic reactions, and should be avoided if possible. Vitamin deficiency anemia. Besides iron, body needs folate and vitamin B12 to produce enough healthy red blood cells. A diet lacking in these and other key nutrients can cause decreased red blood cell production. Also, some people who consume enough B12 aren't able to absorb the vitamin. This can lead to vitamin deficiency anemia, also known as pernicious anemia. Treat these kinds of anemia. Patient need to take folate and vitamin B12. Coagulation is the other problem of blood. Coagulation, also known as clotting, is the process by which blood changes from a liquid to a gel, forming a blood clot. It potentially results in hemostasis, the cessation of blood loss from a damaged vessel, followed by repair. The mechanism of coagulation involves activation, adhesion, and aggregation of platelets, as well as deposition and maturation of fibrin. Coagulation begins almost instantly after an injury to the blood vessel has damaged the endothelium lining the blood vessel. Exposure of blood to the subendothelial space initiates two processes: changes in platelets, and the exposure of subendothelial tissue factor to plasma factor 7, which ultimately leads to cross-linked fibrin formation. Platelets immediately form a plug at the site of injury. This is called primary hemostasis. Secondary hemostasis occurs simultaneously. Additional coagulation, clotting, factors beyond factor 7 respond in a cascade to form fibrin strands, which strengthen the platelet plug. Disorders of coagulation are disease states which can result in problems with hemorrhage, bruising, or thrombosis. Coagulation is highly conserved throughout biology. In all mammals, coagulation involves both a cellular platelet and a protein coagulation factor component. The system in humans has been the most extensively researched and is the best understood. Aspirin is a mostly common use drug to treat coagulation illness. Aspirin, also known as acetylsalicylic acid, ASA, is a medication used to reduce pain, fever, or inflammation. Aspirin inhibits granulocyte adherence to damaged vasculature, and inhibits the migration of polymorphonuclear leukocytes and macrophages into the site of inflammation. Aspirin given shortly after a heart attack decreases the risk of death. Aspirin is also used long-term to help prevent further heart attacks, ischemic strokes, and blood clots in people at high risk. It may also decrease the risk of certain types of cancer, particularly colorectal cancer. For pain or fever, effects typically begin within 30 minutes. Aspirin is a non-steroidal anti-inflammatory drug, NSAID, and works similarly to other NSAIDs, but also suppresses the normal functioning of platelets. One common adverse effect is an upset stomach. More significant side effects include stomach ulcers, stomach bleeding, and worsening asthma. Bleeding risk is greater among those who are older, drink alcohol, take other NSAIDs, or are on other blood thinners. Aspirin is not recommended in the last part of pregnancy. It is not generally recommended in children with infections because of the risk of Reye syndrome. High doses may result in ringing in the ears. What is gout? Gout is a type of arthritis that causes pain and swelling in your joints, usually as flares that last for a week or two, and then go away. Gout flares often begin in your big toe or a lower limb. Gout is a familial metabolic disease. Gout happens when high levels of a substance called serum urate build up in the body. When this happens, needle-shaped crystals form in and around the joint. This leads to inflammation and arthritis of the joint. However, many people with high levels of serum urate will not develop gout. Formation of uric acid calculi in the kidneys may also occur. Gout is usually associated with high serum levels of uric acid, a poorly soluble substance that is the major end product of purine metabolism. The treatment of gout is aimed at relieving the acute gouty attack and preventing recurrent gouty episodes and urate lithiasis. Colchicine is absorbed readily after oral administration. Metabolites of the drug are excreted in the intestinal tract and urine. Colchicine dramatically relieves the pain and inflammation of gouty arthritis without altering the metabolism or excretion of urates, and without other analgesic effects. Indications: colchicine is used for alleviating the inflammation of acute gouty arthritis. Adverse effects: colchicine often causes diarrhea and may occasionally cause nausea, vomiting, and abdominal pain. Colchicine may rarely cause hair loss and bone marrow depression. Thanks for watching. If you like this video, please click I like this, and welcome to leave a message. You must be my biggest motivation to make the video. Please subscribe to the channel, where you'll find more and more medical videos here later. Thanks.